And then if we start talking. Yes. Okay.
And now you should hear me come through very clearly.
Period.
And
Okay, that's amazing.
there should be no echo. So stop it really quick.
We're just going to talk.
Turn
Okay.
my phone on, do not disturb.
You're so good. I should do that too.
That's why it's not vibrating and it shows up on the
Yeah.
recording.
Okay. So I want you to sit how you're going to be sitting and put the mic just like up to yourself. Start talking.
Hello. Yes. Me.
Introduce yourself.
Hi, my name is Cassie. I am a first year here at Alma College. I'm a psych major.
Keep talking.
I'm a psych major. My favorite color is purple.
Okay. So keep talking. Just
Okay.
blah, blah, blah.
Okay, I currently use a single crutch as a mobility aid. I have a leg brace that supports my meniscus and my ACL as they're in recovery.
All right. All right, everybody. Welcome to the podcast. So today we have Cassandra McGaugh, and this is your host, Justice. I work for the Almanian. That's what this podcast is through. And so what we are going to be talking about today is actually kind of a rough topic that most students will not experience. So Cassie, could you introduce yourself, your name, your major, what you like to
Okay.
do, and what's wrong with you?
So hi, my name is Cassandra McGaugh, or Cassie. I use any or all pronouns. I'm a first year here at Alma College. I'm a psych major. And I have problems in my left knee, specifically a previously torn ACL and thinning of the meniscus, along with fibrous tissue growing in my knee.
So can you talk about how that happened,
Yeah.
why that's going on, and what your experience like in a brief synopsis? Because Cassie and I are friends, so we've talked about this in depth, and there's a lot going on. But to like a kindergartner, could you explain to the
Yeah.
All right, so we just started up again, so we're gonna take this out. Just start with when I was in high school.
So when I was in high school, it was my senior year of high school in the spring, I was getting up to get on the bus, and I had fallen backwards because I hyperextended my left knee and put too much weight and pressure on my knee, and that ended up putting a little rip in my ACL. But I was so dedicated to this theater performance that I was supposed to be in, and only an hour after I had torn my ACL, that I was told that like it probably wasn't anything bad, so they gave me a leg immobilizer and sent me off to do the performance. So I did. I did all 4 performances where I was moving around, jumping, running, coming up and down stairs on my own, unassisted, the entire time. It was so silly, and it took my doctors I think a 2 to 3 month period to officially diagnose me with an ACL tear. And I had been given orthopedic support through another knee brace that's supposed to help athletes so they don't hyperextend their knees. And I was told to just like go on activity as normal. I could go exercise, I could go do whatever. This was not the case, because anytime I would try to straighten out my knee, it would bend backwards, and it would further tear my ACL and my meniscus. Because once the ACL is fully torn, the meniscus is the only boundary left to defend your knee.
And where in your knee is your ACL and your meniscus?
My ACL and my meniscus are located in the back of my knee. The meniscus is a piece of cartilage that is your shock absorber, and your ACL is another shock absorber, but it is tendon tissue that prevents your knees from bending backwards when you straighten them.
So how long ago did this happen, and how old are you now?
So this happened when I was 17, and I will be 19 in June.
And it's currently March.
Of 2024.
So how are you feeling, like, before we get into, like, on-campus stuff?
Yeah.
How did this affect your introduction to college?
It already made me really, really sad because theater is a huge hobby of mine. It's not something I want to pursue as a career, but it was automatically canceled as an option for me. And I knew I would need a lot of support on campus, and it made me really, really sad because I had to just like level with the fact that I'm not going to be able to be as active as the rest of my peers, and I have to constantly think about how I'm walking so I don't hurt myself.
Yeah, Cassie walks kind of funny. And it's horrible because your one leg is affecting your other leg.
Yeah.
And you're literally not even 20 yet. Like, you're not supposed to have mobility issues at this age. Like, that's not a normal thing.
Yeah.
What was it like for you coming into college as, technically, I mean, if you're cool with us saying this, as a disabled person?
Yeah, and I am technically disabled in multiple ways, but we don't have to
Yeah.
talk about that right now. Excuse me. Sorry.
You're good.
Coming into college as a disabled person, it was really, really strange because my disability was all but invisible because my small knee brace that I had only went up to my mid-thigh and then my lower calf. So when I would tell people, oh, I have a torn ACL, or I'm struggling with this, they'd be like, okay, then just like live life as normal. Like, just don't even have problems.
Yeah, because at first it wasn't that big thing.
It wasn't a big deal. Yeah.
I forgot about that.
Yeah, I have it somewhere in my closet. I'll show it to you at some point.
LOL. You can bedazzle it later.
Yeah, but like the biggest issue with a lot of these things is that they're supposed to be short term, but they get really, really gross. So that I had that brace from I think Easter until the day before my surgery. So it got covered in sweat and dirt and whatever else, and you
Yeah.
can't wash it because it could get all rusted. And I don't have access to the inner mechanisms that support my knee. So yeah, that one's all sweaty and nasty.
So when did you have surgery?
I had surgery on October 19th of 2023 at 5 a.m.
While you were in school.
Well, I was in school, yep.
So what was your experience like having medical leave?
So I was really freaking out about medical leave for a super long time because I would go to different people and they'd tell me to go to another person and then they'd tell me to go to another person. And it was not like for a lack of them being incompetent or anything. They were just trying to give me support until I found the right person. We all know who the person who helps you with medical leave is. She's a great person.
She literally slays.
She literally slays
We're
so
literally
hard.
going to shout her out because we're allowed to say her name.
We are, yeah.
We will not say most names on this podcast. You won't hear
Yes,
most names.
unless
But
it's,
Betsy
like, positive.
Strobel is an amazing person.
Yeah, I think we're giving like resource, so like it's okay.
Yeah, she's in the CSO. Well, not anymore. It used to be in the CSO, but she's in the Learning Commons. She's our disability services person. She slays. I definitely can guarantee you Cassie sat in her office and was like, what do I do? And Betsy was like, it's going to be okay.
Yep. I didn't even have an official appointment with her most of the time. I just like stood outside her office and I was like, "Can I come in?"
And she's like, sit down. Tell me about the tea.
So, for anyone who else wants to get medical leave, all you need at the absolute most is like a note from your doctor. Not even like saying that you need medical leave. Like I just had to show her the sheet that said my surgery date. And then I was able to estimate my recovery date. And even after that, she said, okay, well, just let me know if you need it extended. She's super lenient and super kind about it.
Yeah, and I've had medical leave too for reasons we'll talk about on another episode. And like sometimes you need it, but a lot of times if you've got a specific surgery, like I had a surgery a couple weeks ago. Literally, yeah, that's epic.
Yep.
So that was a more positive aspect of it.
Yes. Literally, I think Betsy has probably been one of the most supportive people next to Alice Kramer.
Yeah.
Who have been like the most supportive people staff-wise.
Yeah.
So I was given, I think, a week and a half of medical leave, and she penciled me in for an additional week just in case I needed extra time. And my medical leave started the day before my surgery, but I still went to class.
Go, Scott.
Mainly because I wanted to get as much instruction time in as possible because I would be missing out on like at most like 2.5 weeks of instruction. Yeah. And it's my first year here, so like you can tumble down the GPA slope really, really
Let me
easily.
tell you something. If anybody in here has been here for more than a year, the amount of crap that this person has gone through, I am amazed she hasn't dropped out. Like, literally, kudos to you because, like, most freshmen, their biggest problem is, like, a roommate issue, which is huge. Like, it affects your daily life.
I have one of those,
and you've
too.
gone through, like, that times 100. It's insane.
Yeah, and I don't want to sit here and be like, oh, poor me.
Cassie's been through more than a lot of people go through their whole time in college, and she's
Yeah.
only been here a semester and a half.
Yep. I think we'll talk about this later, but I think for all of the like the little mini struggles and stuff like that I've had to like go through to like get support, I have to also remember that there are students who can't even go to college. There are people who don't even have this opportunity. So I can sit here and whine and complain about it, but I also have to realize that there are people like in Gaza right now.
Yeah.
This is a brief tangent off in a moment, but
Cassie does a lot of tangents. That's why I love her.
I saw a TikTok video of a young woman who had to get knee surgery without anesthetic. And if anyone here has ever had a knee surgery and experienced the level of pain that I did, you know that even with medication, it's really, really bad.
Yeah.
So I just, at the end of the day, I have to reconcile with the fact that, yes, what happened kind of sucked, but I'm doing okay, all things considered.
Yeah.
So,
Literally, yeah.
Yeah, okay, you keep asking me questions.
No, you're so good. So what has your experience been like dealing with your symptoms while managing coursework and like being in clubs and stuff?
So I'm going to be very real. Part of me does and part of me doesn't. You manage and you don't.
I like how I said how and you were like, no.
No, I don't even do it. Okay, guys.
Yeah.
I think the hardest part about managing coursework and still having my symptoms is that I have to send a lot of emails, which I used to have really, really bad communication anxiety. Like, even to schedule my surgery, it took me 2 months of building up courage and calling different people to get me to schedule my stuff. But it's a lot of emails sent really, really fast that professors may not read by the time my class period starts.
Yeah.
And all the love to them. I know they're super busy and they've got so much going on. But they're like, there was a time where I hurt myself on campus and I had to send emails to like club leaders and stuff like that. And I was like, hey guys, I can't make it.
Hey guys, I fell and a really nice security officer was like, you want some help? And I was sitting there.
I was sitting there. Anything that I would have to say is that just be so for real with your professors. It doesn't matter how, like, it does, but it doesn't. It doesn't matter how grotesque you have to get, because after I got my medical leave approved, I wrote up a document that gave a day-by-day breakdown of the assignments that would be assigned from me in each class, what day of medication I was on, because I had a 3-week prescription for Norco. And
Norco what?
Norco is a narcotic.
Oh.
I think, yeah, it's a pain management narcotic,
Yeah.
which is half Tylenol, half a really, really heavy sleeping med.
You're sitting there in class like...
Yeah, and that's why I didn't want to go to class while I was on that medication. I didn't even want to do schoolwork because, I'm not even joking, there was one day where I forgot how to read.
I don't think that it's you didn't want to. I think it's that you couldn't.
Exactly, like, there's so much of me that's so anxious to get my schoolwork done, but there's also so much of me that knows that I need to heal. And that school anxiety only made like recovering worse because I was so nervous about not being there on time to class that I would just freak out.
Yeah.
And this is like no shade to any professors because it was literally just a me thing. My professors, I'm not even joking, I'd email them like once or twice a week and I'd be like, sorry, I'm still in pain. I've updated the sheet. And
you're like, per my last email.
Literally. And in that little sheet, I put in my estimated comeback date, where I would be, what I'd be doing, and how I would be communicating to people. And on top of it would be a color-coded highlight on the day to let you know how many emails I'd be responding to, if I could be competent enough to respond to anything.
Yeah.
And I wrote it down and I didn't even follow it because...
like, you were literally so like drugged up you couldn't do it.
Yep. I would check my email and then read the emails and be like, I have so much, I can't do this right now.
You're like, I can't even see my breakfast, let alone do this homework right now.
Oh my gosh.
So did you find yourself like, because I always like to bring it to a place of the Alma curse.
Yes.
Which I don't know if it's any one person's fault, but we are told that we constantly have to be working. We cannot give ourselves a break. There are students who, simply because of their schedules, they literally cannot have lunch because of their class schedules. That's like their main requirement.
That's a me thing.
Yeah. So how has it been for you given the Alma curse? Because it's not something for our viewers, listeners, you don't have to follow that. The Alma curse is a made-up thing.
Yes, it's very much like the Midland Bubble, if anybody knows what that is.
Period.
Yeah. So I made sure to make my coursework light and fun for my first semester because I was told, oh, you'd be up and walking immediately after surgery, and by the end of your semester, you'll be recovered and walking, and you'll be fine, so you can take a heavier course
Which is
load.
all a lie.
It was a lie.
Can you tell them about how you walked out of the hospital? Because that's my favorite part.
I didn't even walk out of the hospital. Okay, we'll get back to coursework in a second, but so it's part of protocol that your post-op nurse is supposed to stand you up on a walker and then watch your legs move to make sure that nothing's out of place and so that they can assure that you're safe to leave the hospital. They asked me if I felt okay, and I felt great because I was so heavy on pain meds, and they just gave me like 4 bags worth of antibiotics.
I'm doing good
I was
tonight.
like, yeah, I'm feeling great, guys. Like, I don't even know why do people even feel pain after this? What's going on? I was just really, really tired.
Yeah.
And so they put me in a wheelchair that bends your knees. It's one of those wheelchairs where your knees have to be bent. They can't straighten out the leg. And they discharged me with my brace bent at 15 degrees. Even though it's supposed to be bent at 0 so that, like, it's like how science works, is that you're supposed to heel it out at its max stretch, which will be like, technically, even though it's 0, it's still a stretch, so it can rest, and then once it's at its resting position, then you can work on bending. So I was stuck at, like, anywhere from 15 to 20 degrees my whole recovery. And they also
did they put you in a walker ever and have you walk?
No, they didn't. They just put me in a wheelchair and wheeled me out. I'm not even joking. They wheeled me out a back door into my mom's car.
And did you stand up at all before you were expected to stand up out of your mom's car?
No. When I got back to the house, it was the first time I stood up, and I didn't know how much my leg was in pain and how heavy my leg felt until I got there. Like, I was feeling fine all throughout the car ride. I didn't have any nausea afterwards. Like, my partner's mom
I
was thriving. My mom's partner bought me sushi, and I was, like, gobbling it down because I was so hungry.
Yeah.
And it was so good. I didn't feel any nausea. And they stand me up. And I only have one crutch at that time. And so then
they sent her home from the hospital with a crutch. And then she had to order a pair off Amazon.
Yes, and
they also
discharged me with 1 compression sock when I was supposed to have 3 pairs. Not even like a pair of compression socks.
Nice.
And I get that they were busy. Okay, I get that they were so busy and they had so much to do. And I was already like a patient that made them anxious because.
But also basic care of your patient.
Exactly. Like
the surgery was not done in Alma.
No, it was not done in Alma. I will actually probably be considering either Alma or Grand Rapids for my next surgery, which we'll talk about that in a minute.
So how, dealing with the aftermath, what about like your emails, your coursework?
Oh, girl.
What was your experience like? Did you feel at all like, because I feel like if I was in your position, just because like I know how you think a little bit, like, were you ashamed of yourself?
Oh, I was so ashamed.
Because, like, there's no reason that you would be, but also, like, it's completely unrealistic, but also, like, you literally made a spreadsheet. I feel like most students would be like, bro, I'm gonna be out.
And, like, that's actually what made me really happy is because I sent it to one of my professors, and he's literally one of my favorite professors. I had him for English. He was great. And he was like, this is the most detailed medical leave form I've ever seen in my life. Thank you so much.
Like, he's like, Bestie Miss Wetsty, did you have breakfast?
Exactly. So I did feel a lot of stress and I felt a lot of shame about work because even though I told my professors I would be on low to no contact throughout my experience, I still would like send them an email like sometimes every day.
Guys, just letting you know I'm having a really great day.
I would literally email them and I'd be like, I'm in so much pain right now. So all of the assignments that you technically don't have to hold me to are gonna be late.
And you didn't even need to do it, but you did because some professors are hard, and also sometimes if you go MIA, you get starfish because people care.
Yes, my professors are great. I really liked my first semester professors. I still talk to some of them. Like, some of them email me and they're like, girl, do you want to join my class next semester? And I said, girl, I don't know.
You're like, am I even going to be able to walk ever again?
Exactly.
Recently, Cassie started using only 1 crutch, which is a huge deal. She got her own lunch at Saga today.
Yes. Okay, can we talk about that for a second?
Absolutely.
The dignity and humanity in being able to bathe your own body or like get your own food.
And people respecting that it's your own bathroom.
Yes. I still have problems with that. Oh my gosh. That's another topic. But
shower chair.
Smells like rotten eggs. So, like, when you see, like, disabled students and stuff like that, this is just me preaching for a second. When you see students with mobility aids and disabilities, hold the door open for them.
Oh, gosh.
Because
Gosh.
I promise you, it is so exhausting just to move around. Like, I'm doing cardio every single day with how I have to move around in my crutch, and it's so painful. And there's so many other students who need so many more
Sorry,
more
my computer was making a grilled cheese. You keep talking,
who
Cassie.
need so many more mobility aids and need so much more assistance, but like hold the door open for them. If they need you to open a door or grab something off a shelf for them, please help, because if that assistance isn't given, a lot of the time those students will re-injure themselves. Like, I had to have a whole safety plan set up with friends that if I fell in the shower, they could come peel my naked butt off the floor.
Nice.
Yup.
And also, like, you had to, like, ask Marcia at Saga to get you your food sometimes. Because
Yes.
nobody would be available, and it's like...
Yup.
And one time, I was at the, like, salad bar, and Cassie was up there, and I was like, girl, and she had 2 crutches under both, like, each armpit had a crutch. She was trying to hold the salad and walk at the same time. And I was like, girl, your ranch is gonna spill.
There were so many times where I dropped a plate, but I did really appreciate this, is that nobody clapped when I dropped my dishes because they felt bad.
Which, by the way, if you're listening to this and you clap, you better think about yourself. Because every time I'm in Saga, I go, boo! Because, oh my gosh, people don't understand how detrimental, they have no idea how harmful that is.
Yup. And I'm not even joking, everybody at Saga, all the employees are so nice. They're like, you better sue that school that didn't help you. You better sue your doctor. I'm like, girl.
Sue everybody. Sue your mom, your uncle.
Literally. The lady who works at the salad bar most days who, Justice really
yeah.
likes, she talks to me
what's her
every
name?
other day.
Mary.
Yes.
She used to be, for anybody who's older, she used to be the pasta lady, Mary. Oh,
Yes.
We love you, Mary.
And she talks to me about a scar oil and vitamin E oil that I'm supposed to be taking so that my scar tissue heals up and I feel good. And I said, yes, Queen, I will do whatever you need. Just ma'am.
Period. What has it been like for you? Because you've started to gain some mobility back, and you were kind of on track, and then you had a setback, and you were also in way more pain than is normal.
Yes.
What has that been like for you, having those setbacks and at the same time being expected to continue in academics, and also for yourself needing to continue school?
So, when a lot of people ask me that question, I literally, and I'm not saying I'm not being like, you're unoriginal. I'm just like, people ask me that question a lot, and I have to tell them, like, I go to school because I have to.
I'm in the same boat,
And as
dude.
sad as it is, I don't have another option. It is
Yeah.
go to school or I drop out. And if I drop out, I don't have a place to stay.
Yeah.
Because it is expected that where I'm staying, I go to school or I get a job, and I can't get a job because I'm disabled. So
We love this cycle.
so the only options are student. So
Yeah.
however I plan to manage, I manage. Like right now I'm reorganizing like 18 different things because everybody decided to schedule things at 7 p.m. Which is okay.
Yeah.
That's literally nobody's fault. But like I can't, not only can I not be 2 places at once, it takes me like 30 minutes to get anywhere.
Yeah. Yeah. I learned really early on, because Cassie and I have only known each other for like a few months. I
Yeah.
learned really early on that you cannot expect her to be anywhere on time. And it's just, you gotta respect it.
Yep, if I'm there on time, it is a miracle, and I left at least 20 minutes early thinking that I'd be 10 minutes early.
Yeah. Oh my gosh. Have you had any experiences that have made it more difficult for you on campus?
Oh yes. So first off, this is no hate to the maintenance or Alma College themselves, but their infrastructure is not accessible.
Wait a minute, Cassie.
Yeah.
You're telling me that a couple elevators and a couple buildings and a really steep ramp on the corner isn't accessible?
Yep, and I live
Whoa!
in Brusky, so like the 2 main access points are by a staircase, and I can kind of take stairs right now. I just have to be really slow about it. But I think there needs to be an elevator in every building, and I know it's so expensive, but we could allocate the budget. We could find it. We could find it somehow. And the ramps are uneven. There are times where you will reach a pole at a ramp, like on the railing, and then the ramp will increase or decrease in incline, which not only makes it incredibly hard for crutch users or like any like mobility aid user, because that change in incline can make you slip up. I think some of our ramps here are entirely inaccessible to wheelchair users.
Oh, yeah. Like, if you think about Mac Mall, can't do a 360. That's a 180 turn. You can't
even do a 180 turn. I think you would have to stand up, grab onto the rail, and then move your wheelchair for you.
Yeah.
And that might be me someday if things keep going as the way they're going.
Which is terrifying because what they don't think about is that a lot of people who are not disabled become disabled or have, like, their disability gets worse. And it's like, people who visit Alma probably just decide if they're in a wheelchair, I can't do this. It's just not accessible.
Yep.
But if you come in and then you change that and you want to stay here.
I am fortunate enough, though, because I did have campus security to move me around for medical purposes. Yes, I love the campus safety staff. They're so amazing and they're so kind. You just have to, like, keep in mind their schedules because they do have, like, contractual obligations to meet.
Really?
Yeah.
Yeah.
But I think Alice Kramer or Carla Jensen, I think those were the women that I met with because my first day back, campus safety didn't know my situation, so they didn't come and get me places. And my first day back on campus, the first door heading into SAC, that kind of works sometimes with, like, the button hit me and I fell on my face. I was just fortunate enough that I didn't bend my knee because I was at restriction still where I couldn't have my knee bent. I was still, like, fully wrapped up in all my bandages and stuff like that. And, like, I'm not even joking, like a toy soldier, I just, like, fell onto the ground. And the provost thought I cracked my head open and called 911.
We stand Sean Burke in his household.
I love the provost.
We stand him.
Yes, we do. And they thought I fell and cracked my head open. And then campus safety had to come by and they're like, oh, so we understand now. And then I had to go to, I think, Alice Kramer. And she said, well, I can talk to them so we can make sure that you're getting around safely. Because I'm not even joking, re-injury is really, really bad.
Oh.
Even though it is super common for ACL tears, even though my doctors told me, you won't tear it again. You'll be fine.
What was your last appointment like? Like, what happened after? Because have we talked about your second fall?
Okay, yeah, we'll do that really briefly. So my second fall, I was walking with a cane, and I was actually about to be approved to not walk with my cane anymore. I didn't have my brace on. And I was working with working mobility, which means that I have enough to be able to walk, but I can't necessarily do things like run a mile or do intense exercise. Like, I went to the rec center and I worked out.
Period.
And it was amazing because my legs were, like, strong enough to support me to do, like, weightlifting and stuff like that. I was on my way to a GSD event. And I literally was on my way to the Learning Commons, and I rolled my ankle, and my calf fully touched my thigh, and I landed on my kneecap. And according to one of my friends, I screamed so loud, they heard me from the 3rd floor of Newberry, and they were the first person to find me. And whoever this one person was, thank you for being there, but there was, like, an angel who descended from nowhere, and she was like, I've experienced this before. I had the same surgery and I retore my muscles. And I'm so sorry that you're hurting. Let me call the AOD and let me call campus safety.
And that's a student, right?
That was a student. And I'm like, oh, thank you. And I was sitting there crying and I didn't even know what was going on. And I couldn't even answer questions right because I was so scared.
You were in fight or flight.
I was. It was so bad. And then, like, a bunch of people started gathering around, and then I got really embarrassed because I was in, like, sweatpants.
They're like, whoa, a girl fell. Let me look at that for about 10 minutes.
Exactly. And I sat there, and I went from being able to move my leg pretty freely, and, like, I was about to send my shower chair back because I didn't need it anymore, to I couldn't even move my leg at all. I couldn't activate a single one of my muscles without it being excruciatingly painful. I needed, like, 4 people to lift me up onto a chair that someone got from Clack.
It was a full campus-wide effort.
It was. And then two of my friends who are really amazing, they went to the ER with me and they sat with me and I was like, guys, I'm scared. And from the ER visit, they just gave me goddamn Tylenol.
And you were there for 5 hours.
I didn't
which is pretty normal for an ER visit, but like it was what, like 10, like you were there like 7 to 11?
Yeah, and I didn't get food, and they put me in the fast track room, by the way. They put me in like the actually you need assistance room.
Yeah. I was in that room when I was there like a few months ago, and I remember like they moved me right away because they were like, oh, she doesn't really need help. But you were in there like the whole time.
Yep. And I think their wheelchairs are very silly, but also not accessible because you have to bend your knees to sit in them.
They should have a robot that just like sits you down.
Yes, and I didn't want an ambulance ride because I didn't know if it was covered by my insurance.
Yeah.
And I'm like, what I needed most was like a friend and not some random EMT being like, "How is your kneecap?"
He's like,
literally. So, Justice, a friend, and I went to the doctor after that to my original surgeon that I in Midland. And
can I explain that a little bit, like
yes,
from
go
an
ahead.
outsider's point
Please
of view?
tell me.
This lady walks in, and I didn't know she had an iPad on her, but apparently she had an iPad on her. She's like, meniscus 32, 87, 69, meniscus 47, 82, 69, and she's like saying like at the 13th degree, the ABCDEFG and the ACL BBB meniscus, and
Yep.
like she had no bedside manner.
No.
There's no chance she's listening to this. This lady had no bedside manner. And the weird thing is that you told me, wasn't there an online visit that you had?
Yes, and then I
where
had an
she was
online visit.
super nice.
She was, yes.
Apparently because there was no iPad available for somebody to take notes on.
I don't know. I think it was just because it was a super quick visit so that she could charge my insurance, and I think that's why she
She's
was
like,
happy.
ooh, another bill.
More money.
And it's not like she wakes up every day like praying on your downfall, but she wasn't really nice.
No. Like she's there to help me, and she when I first told her that I was leaving my parents, she was like, okay, let's figure this out, but not really.
She's like, all right, I'll be praying on it.
Because I asked her if I could switch to Grand Rapids, and she said, well, if you switch to another provider, I don't think you're going to be able to get the surgery, which is false, by the way.
Whoa.
That's false. That's not true. If you switch to another healthcare provider, you will get your surgery, and I actually might have gotten it sooner because it was rescheduled like 4 times. It was originally scheduled in July, and I got it in October.
I didn't know that.
Yeah.
What?
Yeah. So we go there, and I know she has to assess my knee at this other appointment that Justice was at. And I know she has to assess it to see what's wrong. But I'm telling her, like, it hurts to move my knee at all. I'm in a lot of pain. Can you please be gentle? And she's not gentle at all.
It's like if you've ever had Legos, like where the knees don't bend very good.
Yeah.
And you like really crank it, but you know it's just a piece of plastic.
Yeah.
That's how that doctor was.
You know those the chiropractor TikToks where they're like breathe and it's like a skeleton, and then they literally that's what it felt like, because like she would hold my knee that was like bent ever so slightly over the table where my kneecap was just hanging off, and then would push on my kneecap. And that hurt so bad.
Even just hearing you say that, I want to cry.
And to all the IPHS students, I know it's super necessary and it's super important, but it hurt so bad, and she didn't even apologize.
There's definitely a way to do it that's like, may I do this? Like, she just walked in and started moving you around. She didn't say, may I pick up your leg? She was like, girl, we got to get going. I got a surgery in 5 minutes.
Because she's a surgeon mostly, and the center where she does her orthopedic surgery is literally a parking lot over. So she stops in the office, and I think she's only in the office every other day for about 2 hours. So she's very exclusive, and she's only in there to do consultations for surgery. And she said, well, I think your meniscus tore in half and then flipped, which I don't know was a thing, but anything is possible, I guess. And I'm already missing 20% of my meniscus from my last surgery.
And what does your meniscus do?
So my meniscus is a shock absorber, and it was my lateral meniscus. It's a piece of cartilage.
What's a lateral? Because you just took a psych class about this.
Lateral, standing up.
Period.
It's upright, yeah.
She made hand movements.
Yeah, straight up hand. It's just, so there's your horizontal and your lateral meniscus. It's basically kind of like a box of cartilage that protects you. Yeah, and I almost immediately started crying because I'm already missing 20% of my meniscus, and if it is torn in half and flipped, then it is most likely not going to be repaired. And I thought I was gonna never walk again. Aww. Because like Justice was in the car with me. I was like, life is unfair.
I let her sob. You know what? Sometimes you just gotta sob, Bob.
Yup. And I was like fully mentally preparing for another surgery, because the worst part of surgeries for me is the needles, because I have a terrible fear of needles. in the medical environment because it always smells bad and it's scary and it's like,
And then you leave and you smell like it for a while.
Yep, and I wasn't ready to lose all of the humanity that I had gained back, like that I had fought for, because like when you're in recovery for a lot of surgeries, you can't shower on your own, you can't use the bathroom on your own, and it really made me not only feel but truly understand how it feels to have your humanity lost, which I think has furthered my pursuit into wanting to be a social worker. Like I'm thinking about medical advocacy as like a starting point because it's, oh my God. If I had just had some other adult sitting there to hold my hand and help me make appointments and help me understand what was happening, I think it would have gone a lot differently.
Yeah.
And also, I think they would have actually done their job.
Maybe.
Yep. And most recently, I had a virtual appointment where, as Justice said, she was really nice. And she told me, well, you don't need surgery right now. So what ended up happening is we don't know if it was because of the fall or this has happened and they just didn't do enough scans to check on it. But fibrous tissue that I believe is muscle tissue has grown over my kneecap, which is preventing me from straightening my knee all the way. And it's also making it really painful to move my leg.
And she's been saying she's been in extreme, like, sometimes she can't talk. And I'm like, girl, that's not normal. She's like, I'm fine. LOL. I love life.
LOL. And my meniscus at its surgery site has had some thinning, which means that the joint effusion that they already told me I have is actually a problem. Whereas my surgeon had told me that my joint effusion wasn't a problem. And on top of that, I have mobile kneecaps, which is probably contributing to all of that. So I've got a lot of stuff that they need to figure out, and I need them to tell me as soon as possible because that means I'm going to need to change my activity level, and I needed to change how I treat my body because if my knees give out, I'm going to be in a world of pain because they already told me that I'm going to have mild to severe arthritis for the rest of my life after this surgery. So, yeah. LOL.
Damn.
Yeah.
What's it been like for you, like, because you haven't really always been able to walk to class.
No.
What's it been like for you, like, because I'm currently in a similar state.
Yeah.
Where it's like not necessarily always going to class, going as much as I can, sometimes going when I shouldn't.
Yeah.
You know, and also getting as much homework done as you can, and sometimes being like, I literally can't right now.
Yep.
How has that been for you, like on a level of personal, like, are your professors kind?
So I would say a lot of my professors are very kind about it. Some of them not so much. Like, we're not going to sit here and name any names, but some of them not so much because they don't understand the full extent of my disability, which I don't have to. You don't have to tell your professors you are disabled. It is technically a violation if they ask you.
Yes.
Like that could
And
go,
if they comment on it or they harass you.
Yes. Do not let your professors harass you about your disability regardless of what it is. It is literally, it could go under a Title IX. You should talk to the CSO about it or anybody because it's not okay and you shouldn't let yourself sit there and take like verbal or physical abuse from your professors because I know it's part of the Alma curse. It's really hard to get to class and you have to work really hard to do all your stuff, but you also have to be an adult and treat your body kindly because after college, if you have run out your body, what's the rest of life going to look like? Mm-hmm. I will say this, a lot of the female professors are really, really nice about it. I think that's because I'm also female presenting.
Yeah.
I think they also kind of get it. If you talk to professors who've had knee surgeries or have had something similar to what anyone else is experiencing, they're going to be really sympathetic.
Yeah.
And there are some times where like I said earlier, you just have to be grotesque and gross to your professors for them to understand your situation. And they don't even have to understand it. At the absolute worst, you say, if you don't like it, we can meet with the provost. If you don't like it, let's meet with the head of your department. If you don't like it, talk to my lawyer.
Like, talk to my lawyer, aka Betsy Strobel.
Literally, Betsy Strobel, fight for me.
To clarify, she is not a lawyer.
No, she's not a lawyer.
She might as well be because she's so slay.
Yes, Betsy Strobel. Well, she's the best. Okay.
Literally. So, what is the hardest thing for you about being a disabled student at Alma College? Because when you're talking about this, I'm thinking, dang, the whole campus is what? 7 blocks long and 7 blocks wide, unless you count like the baseball field.
Yep.
So what's been the hardest thing for you?
The hardest thing for me has been my own personal struggles outside of school because I live on campus. Most students live on campus. Getting your body ready in the morning or getting your body ready to even get to class is really, really hard. Like my shower chair, it's not anchored to anything, and the cleaners move it, or whoever goes in the bathroom that is actually designated for me to use, because it's so dangerous for me to use a bathroom that's already wet.
Yeah.
And our bathroom styles are like wet bathrooms in Brusky.
Yeah.
But there's a sign up there that says, like, a disabled student's using this, please don't move anything, please don't get the floor wet, because my crutches are not able to handle wet floors.
At all.
No.
I've seen that. You literally slipped in the grass. Your crutch like barely went off the side of the sidewalk and you're like, oh,
I'm going. Yep. And so it's just, there's a huge psychological aspect to it as well, because it's not just I'm physically disabled and cannot physically get there. And I think the psychological one is a lot harder, because you have to sit there and reconcile with, like, 2 weeks ago I was fine and now I'm not fine. And now I have all these needs and my friends can't help me. People can't help me. It's a fight to do my laundry.
And you literally, you cannot, like, the most basic tasks that most people don't even think about are hard. And then on top of that, you have homework. And on top of that, you're trying to walk around.
Yep, and I'm part of clubs, and I am, like, assistant director for a show. And I'm so grateful to have all these opportunities, and I'm so happy to do them, because if I didn't have them, I would sit in my dorm and cry.
Literally.
My first 2 weeks back, I just sat in my dorm and I cried every single day. It was so bad.
I didn't know her then. I didn't know her. I would have brought her chicken noodle soup.
People would just come into my dorm because my door was unlocked. Because here's another thing. I couldn't get out for fire drills. Like, whenever the fire alarm would go off, I couldn't get out.
You're like, girl, hold on.
And the thing about it is that if you don't leave the building during a fire alarm, you can get sent to housing, and you could have some really, really bad repercussions.
They're like, you want to burn in the fiery pits of hell?
Nuh-uh. Which is very smart. It's very smart to give a consequence to a necessary action. It's very smart.
Yeah.
But I would have to have people from, like, the third floor who are friends with me come downstairs and be like, Cassie, it's time to get out. And I'd be like, I can't get out. Like, I think, no, this is just a recommendation. I really think that the RAs assigned to the disabled students should go check on the students.
Yeah.
Because I would have to choose between putting my clothes on and then covering my ears, because the fire alarm is so loud, especially in single rooms. It's like, it's all encompassing.
And the Brusky alarm specifically, I'm in Newbury right now, and it goes, attention, fire alarm, please evacuate the building immediately. And it's loud, but it's not, like, insane. But in Brusky, it's like, wah, 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 wah.
Exactly.
Like, I can hear it all the way across campus.
Literally, everybody's like, oh, Brusky had another fire alarm.
Yik yak's popping.
Exactly. And it's like, oh my God. And then I would have to, like, try to crutch out of the building, and it's like 4 a.m. I'm barely dressed. It's cold. I'm scared.
And you're on crutches.
I'm on crutches, and I can't,
overstimulated.
and I can't go anywhere. And then they would just be like, well, thanks for coming on out. And I'd be like,
and then 2 minutes later, all right, go back in. And you're like, girl, how do I open the door?
Exactly.
Have you had any specific experiences where you're like, dang, this made a difference that is so simple that has made, like, a huge impact?
Yes. So, the first biggest thing is that I had a friend deliver soap to me. A friend brought me soap, and I have money struggles, so sometimes soap isn't really something I can afford. But they brought me, like, a squeeze bottle so that I wouldn't have to use a bar of soap, so that if I dropped it, I wouldn't have to struggle with picking it back up or throwing it out.
Genius.
Yeah, so you could use the squeeze bottle, so that way you can clean your body properly. And, like, I was showering every 4 days at that time, and I didn't shower for the first 3 weeks back at school because my shower chair wasn't delivered.
You could not shower.
I could not shower.
You didn't have a choice.
It's not even like, oh, it would be dangerous. It literally, I could not get into a bathroom. And having someone deliver soap to me, I sobbed. And I wasn't even using it, but it literally meant the world, because I would have to sit there and be like, I need so much help, but I don't want to make my friends feel like they're my servants, but I also have a lot of mobility needs.
And that's where I say, if somebody cares, you will never question it. They will always show you.
Yep.
Like,
And And then like I met you and all your group of friends, and you're like, girl, why are you doing this? And I'm like, I don't know, I'm scared.
Because Cassie and I are both we're both first gens. We're both we both have money struggles, and so it's it's just very different because we're both students who don't necessarily have as much support as many students, and we have to find that support within the community we're put in.
Yes.
And there's tons of people here who are super amazing, but in the situation that you were in, you really,
I
this
needed
is my
help
joke.
at every
You needed a
turn.
parapro.
I did.
You literally did. You needed somebody to be there and that's a joke that I always say when I'm playing games and I lose. I need a parapro because you needed somebody to be like, how can I help you? Can we walk you through this?
Yes. And can I talk about my old roommate? Can I talk about the Sharp Man himself? And
Yes.
Okay.
Yes.
So for those of you who don't know, one of my roommate, Carter.
Rest in peace. He didn't die.
Rest in peace. He didn't die. He was just making big bucks at a bar right now, so he left school.
Yeah.
Mostly because he really wanted to be in a double with me in the first floor of Mitchell, which is what housing was considering putting us in, because I'm a fall risk, and wouldn't it make sense to put a student who could fall to have somebody with them? And Carter and I literally spent every second of our days together whenever we could. We would eat dinner together. He would come to my room all the time. We would play Roblox and not talk to each other for 7 hours. And he found a better job opportunity and left. And I'm okay with that. He's making big bucks right now. You don't even understand.
If you want a therapist internship or to make a lot of money, go work at a bar as a bartender.
Yes.
Or just in general.
Exactly. And he's literally doing amazing, and I miss him so much. But he was my parapro. Yep. And he's not here anymore. And not only do I not have my friend with me, I don't have my help. And I have some amazing friends. Let me make that very clear.
Yeah.
But I think Carter was probably one of the only people.
Carter was your parapro.
Carter was one of the only people who on a molecular level understood where I came from, because we went to high school together, and he saw my slow spiral. He was there when I first hurt myself, and he was like, "Girl, what's going on?
Girl, you fell off the bus."
Girl. Oh my gosh.
Yeah. What has been something okay, let's pretend.
Let's pretend.
There is a genie, okay?
Yeah.
That genie goes into the minds of every single person who has any say about anything on campus, okay?
Yeah.
This genie has no pretense, no prejudgment, nothing, just
hell yeah.
What is something that you wish?
Can I only have one wish?
You can have any wishes, but just from this experience.
Yes.
Because I remember as a freshman, it was a really, I'm so cool. This campus isn't accessible. Isn't it horrible? Nobody I've ever talked to about that has actually been disabled other than you.
Okay, so first off, I think we need disabled admissions officers. I think we need to do disability accessible tours. I know our campus is small, but we cannot offer a very, very true ALMA view if we don't include all of our ALMA students, which we're doing a great job of being diverse. We're doing a great job of having diverse admissions officers and things like that, and admissions tour guides, but we need people with disabilities. We need, let's say we need somebody autistic to work.
You know what I just realized? And I'm sorry to interrupt you.
Yeah.
I can't think of a single professor with a disability that's physical, stopping them from doing physical things.
I think
I've never even
one in the history department.
Yeah, maybe. I've never even seen a professor with crutches or a cane.
One of our theater professors had crutches for a little while a couple years back, and that was about it.
I think that, wow.
Yeah.
Yeah, fascinating.
We need that disability representation, especially in admissions, because let's say we need an autistic guide to guide neurodivergent students and say,
that would have been amazing. I would have loved that.
We need them to say, I am autistic. Here's how
you don't have to go to Saga. Let's eat outside.
Yes. Let's get takeout containers and let's eat on the patio. We need somebody with a physical disability to say, we're not going to walk today. I'm going to sit down with you, and we will have someone bring us food from Saga. Will I tell you?
A go-kart tour.
A go-kart tour. Literally, the golf carts.
Yeah.
Golf cart tours. I know this is really dumb, but another thing I need is that I need Alma to fix their infrastructure. Okay?
Okay, I don't think that's a dumb ask. I think it's a difficult ask because it wasn't made to be accessible in the first place, so it's going to be harder in the second place.
Because disabled students aren't in mind in the college mindset, but now it's necessary because disabled students can come to college now.
Yeah.
But what I need is first, all of the sidewalks need to stop having such severe cracks in them that people's aids can get stuck. My crutches have gotten stuck in sidewalk cracks and holes so often that I nearly fall over, and then I have to like stand there and cry for 3 minutes because I was so scared.
Or you trip and you like manipulate your knee in a wrong way and then you're in more pain.
Yep, sorry.
You're good.
Our inclines need to be less severe. We need more elevators. Our ramps need to actually be consistent and wide enough to fit a double wide wheelchair. Okay.
Why would we do that? Oh, because it would make it so that people of all abilities
And sizes
can have access to the equal education. Wow. It's almost like that's a part of the mission of this college.
Yes. I need the elevators to not sound like you're going to the gates of hell, because it's so scary every single day. I know there's only so much they can do, but consider the following.
Literally.
And I need more disability reps. I think, now this is something that I don't know if that can happen, but in the DI office, we need disability reps.
Yes.
We
If
need
anybody
disability reps.
is interested, there is a sleigh person out there, Maisie Wheeler.
Mm-hmm.
Maisie is very sleigh. We have a panel coming up in a
Yep.
couple weeks. Cassie and I will actually be on it because we've both had medical accommodations. Period. Period. And yeah, she slays. Here's something that I just realized, okay? Alma College creates students who serve critically, serve respond, whatever.
Yep.
Students.
Yes.
Right now there's a silent able.
Excuse me, sorry.
Alma College serves able students.
Yes.
We need that whisper to get out.
Yes.
Because
And
the chapel elevator,
yes.
it works, it's functioning, it slays. It's so tiny. It's the only one on campus that's really like, period, except
Yes.
maybe Wright Hall.
I haven't been in the Wright Hall one because, I can't get across. I can't get that far.
Period.
I haven't even tried crossing roads with my mobility aids. I don't
And
even do
technically,
it.
you're going to be an upperclassman next year, so you would be able to live there, but you can't because of your disability.
Yes. Yummy, so delicious.
Delicioso.
Yep, my only option is either Mitchell or Newberry, and even Newberry has some stairs.
Yeah.
Yeah. And, I can take the Newberry stairs right now, but I don't know what I'm going to be like.
If you were in a wheelchair, you'd get Shrek'd.
No, my only option would be Mitchell, and, yuck. I think the final thing I'd have to ask this amazing genie for is I would need this genie to somehow put the awareness of disability in everybody's minds. Because it's not just knowing disabled people exist, but doing their best in their situations to understand disability needs. Because it's only old people who understand me. It's only like
The amount of times she's come back from appointments and she's like, this old guy told me that I should try XYZ.
At my MRI appointment, an old man came up to me and said, I tore something in my hip. You need to get yourself a knee brace. And I said, yes, sir.
All right, kid.
He was blind in one eye, and he was like, yep, I've seen things. And I think he was probably the best man I've ever met in my life. Just, and even not even on a somber note of that people need to be aware of disability. Just I've had people, word has come back to me from my friends that people have been talking shit. They're like, why does she need this? Why is that necessary? And I'm like, mind your own business.
It's the same idea of why are you poor? Just get money, get a job. Kids these days just don't want to work anymore. Girl, you didn't ask to fall and have knee problems. If you could ask for something, you would not ask for this. So let's say that this genie
Kids don't want to
this
work
year
anymore.
maybe can grant a wish.
Yes.
And from your eyes as a student, we don't know much about big people, grown up stuff.
Yes.
For the college. What do you think is the most attainable, realistic thing that we could do that even students maybe
Yes.
could have an impact on?
I need admissions and their students to start reaching out through more disabled geared events. I need admissions officers to be sent to the summer camps that work with disabled students. I need people to start interacting with more disabled students and encouraging students that Alma may not be the most accessible, but if we make it a population that matters to admissions and matters to the board, we are going to need more accessibility because a lot of major universities don't offer assistance like Alma does. Like, I'm not even joking. The security escorts that I get is more.
Shout out to Lori.
Shout out to Lori at Campus Security.
You are the best. Oh my gosh. If her
Yep.
boss is listening, please give her a $10,000 a day raise.
Exactly. She deserves the world. Okay.
Literally.
It's like we need to. I know it's not. It might not necessarily be attainable because all of the needs for disability isn't attainable.
And it's vast. It would need to be a whole policy thing.
Yes.
You know.
But there was a group of students who went over spring break and built a bunch of ramps. A group of students went and built a bunch of ramps. We have them. We have the power. We have these students to do so. We could build ramps.
Build the ramp.
Build the ramp. We have the infrastructure. We have the money. We can find the funding. We can find it.
If we
somewhere.
can build the Greg Hatcher Learning Commons, we can build a ramp that's
We
less
can
than
build-
an 18th the size of the building.
We can build an elevator in Brusky.
An elevator? That sounds like airplane first class seating.
We could make our
Or
college.
maybe water fountains.
We could make our college not just barely ADA compliant, but make it the example of ADA compliance.
And what kind of student is going to need that support more than anybody else? A disabled student,
And not
where
just-
they can flourish.
Not just our disabled students, our athletes. Do you know how many athletes have done the same thing as me, torn their ACLs? And how many athletes just need that support? Like,
Straight up.
Like, I'm sure that they have all the physical ability to do so because they're athletes. It's their job. But I'm not even joking. I've talked to so many new athletes here at Alma who have so many disabilities.
Oh, yeah.
Like, I've talked to a bunch of people on the track team, and they're like, I've torn my quad, and I've torn my ACL, and I've
And
torn
my booty
everything,
cheek.
and my calves don't work right anymore. And I'm like,
Yeah.
you've been running for 3 weeks. What's happening?
Shout out to all the athletics people, because none of y'all get scholarships. You're just doing that because you love it.
Yep.
Literally so much respect.
One more thing.
Literally speak your
I
truth.
need PT to be offered to non-athletes.
Oh, wait a minute. So you're telling me that there's people at the college who do physical therapy
Yes.
in Hogan?
I believe Wilcox.
I'm being sarcastic right now,
Oh.
but genuinely, in there's people who do PT for,
on campus, yeah.
and you couldn't see them. Why couldn't you see them?
I literally went into Wilcox because I hadn't set up my PT before my surgery, and I said, I heard that people do PT here for people who've gotten
ice baths, really fancy
yeah,
machinery.
athletic injuries, and they're like, "Are you an athlete?" And I said, "No," and they said, "We can't help you." And I literally left and cried because I wouldn't it give these students who are training to be physical therapists more experience with a varied population, because I might need a different care plan than an athlete. I wouldn't call myself an athlete, but I did athletic things.
Oh,
I was a cyclist.
Theater's
I was
a
a
sport.
theater. I was a theater kid.
Literally.
I danced. It was cool. Like, I may not be the body that's built for it, but I did it.
You slayed.
I slayed, and I had a great time. Like, I think that would probably be the easiest change first.
So, in short, build the ramp, build the ramp, build the ramp.
And we need our science students to be on that side, the math students, who can make sure everything's at the right
Can you make
incline.
a quadratic equation?
I need you to use the quadratic formula to tell me how the incline of this ramp. And I
And
need
can you make the incline feel like barely anything for my little crutchies? And can you decorate my crutches? Cassie, it has been wonderful to talk to you. You are our second ever guest.
I'm so excited.
Thank you so much. And maybe someday in the future you'll be back on.
Yeah.
Thank you so much for your time, and thank you listeners for listening.
Thank you for being here.
And also, if you're listening, like, take this and digest it.
Yeah.
Like, don't just listen, like, try
Don't-
to digest.
Like, don't feel bad about not being disabled, I promise.
yeah, it's not your fault you didn't break your leg after theater.